Hey everyone, welcome back to Master USMLE, the podcast where we break down high-yield Step 2 CK topics in a way that sticks. Today, we're tackling a must-know trauma case, tracheobronchial injury. If this shows up on your exam, you'll know exactly how to diagnose and manage it in seconds. Let's get into it. All right, let's set the scene. You're in the trauma bay when EMS rushes in with a 30-year-old male motorcyclist involved in a high-speed collision with a truck. He was not wearing a helmet, and his bike was found crushed beneath the truck's rear axle. The patient is struggling to breathe and has a hoarse voice. He's coughing up bright red blood. You quickly assess his vitals. BP 90 over 50. HR 128. Oxygen saturation 86% on a non-rebreather mask. On physical exam, you immediately notice some red flags. Severe subcutaneous emphysema or crackling air under the skin extending from the chest to the neck. Tracheal deviation to the right. Diminished breath sounds on the left side. Harsh, noisy breathing. It sounds like stridor. First thought? Maybe attention pneumothorax, so you insert a chest tube on the left. But something's off. Your patient barely improves, and there's a huge, persistent air leak in the chest tube. Now what? This is where a high-yield Step 2 CK moment kicks in. Key exam clue: persistent air leak. When a trauma patient has a chest tube placed for pneumothorax but there's a persistent air leak, you should immediately suspect tracheobronchial injury. Why? Because there's a major airway tear, allowing air to continuously escape into the pleural space with every breath. That's why your chest tube keeps bubbling. Why do tracheobronchial injuries happen? These injuries typically occur in high-energy blunt trauma. Think motor vehicle accidents, falls from height, or a motorcycle crash like this case. What's happening inside? The trachea or bronchi tear due to massive shearing forces. Air leaks into the mediastinum, pleural space, and soft tissues, leading to O pneumothorax, O pneumomediastinum, O subcutaneous emphysema. How to diagnose tracheobronchial injury on Step 2 CK. So, how do you confirm your suspicion? First, let's talk imaging. Chest X-ray or CT scan may show OA pneumothorax that won't resolve despite chest tube placement. O pneumomediastinum, or air trapped around the heart and great vessels. The fallen lung sign, where the lung collapses completely away from the hilum. But what's the gold standard test? Bronchoscopy. This is the single best test because it allows direct visualization of the airway tear. If the patient is already intubated, just pass the bronchoscope through the endotracheal tube and confirm the diagnosis. Management. What's the next best step? All right, so you've got your persistent air leak and you suspect tracheobronchial injury. What's the plan? Step 1. Secure the airway. Oh, the patient is already intubated. Good. But sometimes you need to advance the endotracheal tube past the injury to ventilate the healthy lung. Step 2. Surgery. Oh, most tracheobronchial injuries require surgical repair. Oh, small, stable injuries may heal with supportive care, but larger ones need operative intervention to prevent respiratory failure. Step 2. CK exam strategy. Let's talk test-taking strategy. If you see blunt trauma, pneumothorax with persistent air leak, subcutaneous emphysema, pneumomediastinum. What's the next best step? Bronchoscopy. Now, let's go over some common exam traps. Repeat chest X-ray won't show the airway tear. Additional chest tube won't fix the air leak. Talc pleurodesis. That's for recurrent spontaneous pneumothorax, not trauma. Stay focused on bronchoscopy for diagnosis and surgery for definitive treatment. Key takeaways. Let's wrap this up with 3 high-yield pearls to lock this in for Step 2. CK 1. Persistent air leak after chest tube placement means tracheobronchial injury. 2. Bronchoscopy is the gold standard for diagnosis. 3. Most cases require surgery for definitive repair. Master these concepts and you'll crush any tracheobronchial injury question on your exam. That's it for today's episode of Master USMLE. If you found this helpful, share it with a friend and subscribe so you never miss a high-yield breakdown. Got a topic you're struggling with? Shoot me a message and I'll cover it in a future episode. Until next time, keep studying smart and stay focused. See you in the next one.